welcome. My name's Ilse Hampton. I'm the CEO of Meaningful Ageing Australia, and it's just wonderful to see you here with us today to have a think about faith and culture in the context of people who are accessing community and residential aged care services. As we begin, let's acknowledge the traditional owners of the various lands where we are. You might like to hold them in mind or put them in the chat. For me, here in the northern suburbs of Melbourne, it's the Wurundjeri people of the Kulin Nations. So we pay our respects to elders, past, present, and emerging. And here at Meaningful Ageing Australia, many of you know that we do like to acknowledge the spiritual strength of Australia's First Peoples. Well, welcome again, and how fantastic to be spending this short time, probably too short in many ways, with our colleagues from the Centre for Cultural Diversity and Ageing. So we have with us today Lisa Tribuzio, who's the CEO, and Nikki Rittinghausen, who's the Senior Advisor at the Centre. Now, I first met Lisa a few years back. I can't remember exactly how long ago, but it was back in the old days when people came to your office. And she was in a different role, but she'd come across us and was really interested in what we were doing around helping service providers be really inclusive and really tune into what matters to people from a wide range of backgrounds, including people with a faith or without a faith. And I had a great chat with Lisa on that day, and I think we both felt really encouraged by each other's passion for the work. And now she's here as CEO at the Centre for Cultural Diversity and Ageing. So Lisa and Nikki will talk for about 20 minutes, and then we'll have a chance for a bit of discussion with them before we wrap up with a little bit of housekeeping at the end. So we've got this the remainder of the half hour. So I'll hand over to you, Lisa. Thanks so much for joining us today.
Thank you so much, Ilse, for having us today for this presentation around culture and faith. And of course, the Centre for Cultural Diversity and Ageing likes to adopt an inclusive sort of framework in the way that we operate. And of course, there definitely are links between culture and faith. Let's not deny that. How people practice their faith, the diversity of religiosity, and of course the way in which faith can be a personal thing, but also an environmental thing, and it can affect the way in which our environments are and our societies are. So we're going to be talking a little bit about the systems, inclusive systems, and how we can help people feel spiritually and culturally safe in aged care services. So I'm just going to share out my presentation now. Okay. Sorry about this. So as Ilse mentioned, my name's Lisa Tribuzio, and I am the manager of the Centre for Cultural Diversity in Ageing. We are funded by the Department of Health to help providers that are Australian government funded aged care providers that are delivering community and residential care across Australia. And help and support them to understand culturally appropriate care, culturally safe care, how to, program their services and to think about how their organisations are inclusive to people from diverse cultural backgrounds, faith backgrounds, spiritual backgrounds, and to understand that it's not a one-size-fits-all approach to program delivery. Our broad vision is that all aged care consumers in Australia experience inclusive and accessible care, and we deliver inclusive practice training and workshops, capacity building to promote cultural inclusion and equity, and diversity advice and consulting. And our priorities are recognise good practice in the sector. We do have a good practice tab now on our website that you can check out any good practice stories. And we have our excellence awards as well, which we try to celebrate and recognise good practice across the sector around culturally safe and culturally appropriate care. We have a range of resources that we develop on our website that are available on our website, like our communication cards in 63 languages and aged care signage in 63 languages, which are our most popular resource. And we have our practice guides and a section on our website around multilingual resources. So Nicholas is going to speak later about our website and our practice guides, one of them which is spiritual support practice guide. So the Centre for Cultural Diversity and Ageing is a part of the Partners in Culturally Appropriate Care program, which is funded through the Department of Health. So we are part of the Partners in Culturally Appropriate Care, or PCAC Alliance, a national body comprising PCAC-funded organisations across Australia. And the Alliance aims to be a voice and discussion conduit into information, training and resources to inform aged and culturally appropriate care. We have a provider in each state and territory, and we have a Victorian provider. Excuse me one moment, just one moment. I'm so sorry. Okay, so a little bit about the presentation today. So we're going to talk about culturally and spiritually inclusive care from a systemic point of view. So of course, we know that Meaningful Aging Australia talks so much about, people's spirituality, how they understand their own spirituality and connects to their own spirituality, and how systems can be, inclusive of their spiritual diversity. And we're going to complement that through talking about our inclusive service standards, which were developed in 2018 by the Centre for Cultural Diversity and Ageing and recognised by the Aged Care Quality and Safety Commission. We're also going to be talking about our consumer voice film, which is a new resource that we've developed, which helps to promote the idea of culturally inclusive feedback within the aged care system, and how older people from diverse cultural and faith backgrounds can have a voice and give feedback, compliment or a complaint to an aged care service. And then we're going to talk about some further resources that you can access through our website, and other guides and resources that you can tap into. And of course, you can contact myself or Nikki anytime, and the Centre for Cultural Diversity and Ageing at large, for any questions around the complexity between culture and faith in this space. So just broadly speaking, when we talk about inclusion, we like to talk about the idea that an inclusive approach means that we have flexible systems and practices. So we have in Australia, I guess, this idea of a status quo, the way that society operates. Now, if you were to reflect on the way that Australian culture is at large, you know that it's mainly the majority narrative is perhaps of a Christian faith framework. We practice Christmas. We have, the majority of that space is for that particular faith framework. But of course, we have over 170 or so faith and religions practiced across Australia. People have their own connection to faith and spirituality. So I guess what we promote is this idea that it's not a one-size-fits-all approach, that an inclusive organisation where people feel spiritually safe or culturally safe involves practices that are welcoming, safe and accessible for all, and that recognise the unique diversity within every older person that you service, or their families and advocates. And by recognising diversity, that we understand that people have complexities in the way that we define ourselves, or that how our identities and experiences are in the world and how they intersect. And so these are some of the diversity characteristics or ways that we can understand older people that we come across, and of course ourselves as well. So if you look at ideologies and political views, of course people are going to have different ideologies, and these may change over time. As you can see on the left-hand side there's a spiritual identity that changes over time and is unique to each person. So it's really important not to make those assumptions that if someone comes from, say, a certain faith framework, like they might identify as Muslim, for example, that they're going to have their own unique interpretation of what that means for them. So it's really important not to make those assumptions when working with people. And of course, there's ethnic identity, family culture, family roles, sexual identity, and life experiences. And there's so many there. And of course, this is just a bit of an overview, but there's so many more aspects of diversity and human identity that makes us all very unique, and these change over time. So I just thought I'd touch upon that. And when we talk about how to program towards inclusive practice, we advocate for a whole of organisation approach, so a systemic approach to inclusion. And often we find the attitudes towards diversity and inclusion are that diversity and inclusion is an on thing, like it's a nice thing to do. that, you know, it's not really a priority to consider diversity and inclusion in the aged care sector. But we don't think that it is a nice thing to do. We think that it's an essential thing to do. That is actually really important to recognise diversity in everything that we do in order to promote human rights and equal opportunity. And it must start from the top, have a planned strategy and systems which allow monitoring of progress against goals and continuous improvement. So what we mean by that is that it's not just a one program that you do, or, you know, that you had, you had funding for one particular project, for example, but it is actually incorporated within the whole organisation. So the Centre for Cultural Diversity developed the Inclusive Service Standards, and they're aimed to assist aged care organisations to become better equipped at addressing the diverse needs of their consumers and journeying towards inclusive practice. We have 3 standards. The first standard is a commitment to inclusive services. Second standard is developing systems that support inclusive services. And the third one is capacity building for inclusive services. So we're going to go through those a little bit more now. So the first one is commitment to inclusive services. So what we advocate here is that the organisation clearly articulates its commitment to building an environment which responds to consumer diversity and embeds inclusive service provision across all of its systems. So this means commitment from the board, commitment from all the leaders of the organisation, that diversity and inclusion is mentioned within your mission statement, within your annual reports, across the whole organisation, and to all your key stakeholders, that you've that the organisation has considered spiritual diversity, cultural diversity, and like sort of advocates for the inclusion of people from diverse cultural backgrounds. So it's not just, like I said before, a program, it's actually embedded within the whole organisation. So we've got 6 performance measures that go with standard 1. We're not going to go through the performance measures now, but just to let you know that it's not just the standard 1, that there are actually indicators under there as well. Standard 2 is developing systems that support inclusive services. So this is where the organisation actually starts designing or implements inclusive services based on evidence through self-assessment, organisational assessment reviews and consultation with stakeholders, data, research. You might want to collect data about how you actually collect data around diversity, which is a very sensitive topic in itself. It could be in the assessment process, it could be throughout the organisation in when people make a disclosure, how do you manage the disclosure, getting data from your local community, looking at current research in the field. So really keeping up to date with diversity and inclusion, statistics and research and subject matter experts. You might want to join communities of practice. You might want to, engage with stakeholders around spiritual diversity, cultural diversity. It's also about co-designing with certain groups that have specialised knowledge around diversity and inclusion. So it's quite a big standard, and this one has 5 performance measures as well. So I encourage you to have a look at those. And the third one is capacity building for inclusive practice. So this one focuses on the training and capacity building of staff within your organisation. So this is where we talk about having a training calendar, having a multi-faith calendar, perhaps, recognising different rituals within your organisation, incorporating raising awareness of diversity amongst your staff within induction, within KPIs, within every team meeting that you have. And recently we had a webinar where one of the outcomes in our communities of practice, and one of the outcomes was someone was going to put diversity inclusion within each of their team meeting agendas. So just to have that as a topic. So it's incorporated within all of our discussions. And there are 6 performance measures in this one as well. So if you want to know more about the inclusive service standards, they're all available on our website. We have our 3 learning modules as well that you can embed within your organisations. And it raises awareness, or has a bit of an overview of the entire inclusive service standards. And then on our website, we've got all of the performance measures. We've got tip sheets and templates to help you. But of course, you can reach out to us and we can guide you through how to understand them, because they are quite comprehensive And they need to be comprehensive. We're talking about change, we're talking about cultural change and organisational change. And it's not simple. And we don't want it to be simple, and we don't want it to end. We want it to be like a starting point of we don't even know what, for example, some people might not even know that there's an aged care diversity framework, which the government has released. And so some people at the very beginning, some people are in the middle, or some people have launched their diversity strategy and want to start looking at engaging special needs groups, for lack of a better word, into their organisation and consider them further. So everyone's on their different journey. So I'm now going to let you know about a new resource that we've just developed, which is our consumer voice film. And the reason why we've developed this film is because we realised that in terms of getting feedback from older people, that a one-size-fits-all approach does not always work. So putting a survey on your website and encouraging older people to go onto the website and fill out the survey is not the only way to get feedback. And so we collaborated with the Australian Multicultural Community Services, and we did a focus group, and we got some input from older people from diverse cultural and faith backgrounds around what are some of the important things to note when they would like to make a compliment, a complaint, or feedback, or give feedback to an aged care service. And so this film is in collaboration with Red Hat Films, and it's about how to empower older people to be able to make a complaint, compliment, or feedback to an aged care service. So I'll launch it now and see what you think.
أود أن تفهم العاملة التي تأتي إلى منزلي ما هو مهم بالنسبة لي.
क्या सामाजिक सहायता समूह से मैं पूछ सकती हूँ किस प्रकार का मुझे भोजन चाहिए?
म हरेक मङ्गलबार मन्दिर जान्छु के मेरो श्रीमतीको व्यक्तिगत हेरचाहकर्ता मङ्गलबार आउन सक्छ?
去社团找我的朋友对我来讲是很重要的，你能帮我吗？
هل يمكنني الحصول على مترجم؟
हामीले तपाईहरुको यो वृद्ध हेरचाह घर मेरो श्रीमतीको लागि चुन्यौं भने के हामीले हाम्रो चाडबाड यहाँ मनाउन पाइन्छ अनि साथै खानेकुरा ल्याउन पाइन्छ?
All of those questions are really important. People using aged care services have the right to care and services that make them feel respected and heard. So when you and your family speak to aged care services, it's really important to let them know what your individual needs and wishes are. It's also important to let them know when your wishes, your needs, or your rights are not being met.
Služba kaže da ja ne mogu imati pregled. Kako ja mogu podnijeti žalbu?
我在这里很孤独，因为大家都在说英语。我想看中文电视频道，不知道去问谁啊。
सामाजिक सहायता समूह उस प्रकार का भोजन परोसना भूल जाते हैं जिसका सेवन मैं कर सकती हूँ। मैं उन्हें कैसे बताऊँ कि मैं ये उनका भोजन नहीं खा सकती?
म मन्दिर जाँदा तपाईले पठाउनु भएको मेरो श्रीमतीको हेरचाहकर्ताले हाम्रो भाषा बोल्दैन। म घर पुग्दा मेरो श्रीमती साह्रै दुखी थिइन् किनभने हेरचाहकर्ताले उहाँले बोलेको बुझ्न सकेनन्।
You and your family have the right to complain or to give feedback to your aged care provider. You can do this in person, on the phone, or in writing. You can ask for an interpreter if you like in your preferred language. The aged care provider must keep your complaint private if you ask them to do so. On the other hand, if you are happy with the service provided, it is good to give the aged care provider a compliment.
很高兴在社团里能见到我的朋友，感谢你们把我送来这里。
Hvala što ste mi organizirali Hrvatski radio program. Osjećam se sretno.
जो भोजन मुझे पसंद है उसको प्रदान करने के लिए बहुत बहुत धन्यवाद।
إن العمالة التي تأتي إلي وتساعدني لطيفة جدا وأشعر أنها تحترمني.
You can ask for what is important to you from aged care services. You can make a complaint or give them a compliment about their services. Aged care services must provide you information in a way that you understand. Aged care services must answer your questions in a way that you can understand. You can ask for what you need from an aged care service.
Thank you very much, everyone, for watching that. We always welcome feedback as to whether you think it's an appropriate resource. It is going to be translated to 15 languages. So yeah, we will hopefully have that on our YouTube channel in the next few weeks. So yeah, I guess it does. We wanted to show you the film because it does have that sort of faith element to it, in the sense that when people connect to a certain religion or they have a certain spirituality, it does relate to food practices. It does relate to the way in which they have certain things that need to be met, like going to spiritual sites or having an environment that's, you know, for example, spaces of reflection, or they might need to go to a particular community group. They might have certain rituals that they need to express. And some people feel intimidated to ask for that to an aged care service. So we want this film to let them know that they have a right to do that. And so, yeah, thank you very much. Now I'm going to pass it over to Nikki, who is our Senior Advisor here at the Centre and Senior Project Officer, who's going to talk a little bit about some further resources. So thank you, Nikki.
Thank you very much, Lisa. I hope everyone can hear me all right. Okay. Good afternoon from my side as well, and it's a pleasure to be here today, and thank you for the invitation. I just want to highlight what are some of our resources that we have available to support providers, service providers or aged care organizations to deliver culturally inclusive and spiritually inclusive care. So what we do, we have training. We do training. Yesterday we did a training on our communities of practice, which I see some of you have been there as well, which is a great coincidence. So we provide peer-to-peer learning on how organizations can journey towards cultural inclusion and culturally appropriate care. And also we do other trainings like working with interpreters. Culturally inclusive feedback is coming up in November. So a few training opportunities. If you check out our website, you can see them.
I'll have to thank you and direct everyone to your fantastic website. And I'm sure if people have got questions, you'd be very happy to catch up with them outside of the session as well. I'm sure we can see lots of connections between Meaningful Ageing Australia's approach, our national guidelines for spiritual care and aged care, and those practice guides and all the fantastic work that you've been doing at the centre there. So just as we finish off, let's give Lisa and Nikki a little Zoom clap.